We begin this half hour with a new tool in fighting the opioid epidemic. Nearly 1 million Americans have died from a drug overdose since 1999, mainly from opioids. In New Jersey, Camden County has one of the highest overdose and drug-related fatality rates in the state. CBS News medical contributor Dr. Celine Gounder has more on a new treatment to drug addiction that's showing promise in that community. Dr. Gounder, good morning.
Good morning, Jeff. We've learned it's not enough to use drugs like naloxone, commonly known as Narcan, to reverse someone's overdose. We've got to get them into medical treatment. And now doctors at Cooper Medical in Camden are trying a novel way to encourage this.
Throughout the city of Camden, the battle against the opioid overdose crisis is a daily fight. For those who live here,
How high up?
and for the first responders.
It's better than it used to be. It's still in the thick of it, I would say.
Paramedic Laith Shubar has worked in Camden for the past 3 years. Paramedic Corey DePatry for 2.
It's a lot of poverty. There's a lot of mental illness that goes on here, especially untreated mental illness in this population here, and a lot of drug addiction in the city of Camden.
The pair work for Cooper University Healthcare, one of the major healthcare systems serving the area. On average, they respond to 3 overdose calls per 12-hour shift. EMS Director Rick Rohrbach.
They would come in at 7 in the morning. They would go out, they would reverse an opioid overdose, and by the end of their shift, they were going out and reversing the same patient with another opioid overdose.
Within the same shift?
Within the same shift.
A level of demand that EMS Medical Director Dr. Gerald Carroll also had to navigate in the emergency room.
How have you seen drug use, drug overdose change over the last decade or so in Camden?
All of a sudden, half the patient board in the emergency department would be overdose or unconscious or drug-related problem, which had never been like that.
Over the past decade, overdose deaths more than doubled, now hitting 110,000 deaths per year. 75% of all drug overdose deaths involve opioids.
When the data started coming out that every overdose we see has a 1 in 10 chance of dying in the next year, that kind of put that all in perspective for us.
That's when Dr. Carroll and his colleagues in Camden started their study with the medication buprenorphine. Bup for short is taken orally to treat opioid withdrawal and stabilize patients. The study found that by equipping ambulances with this medication and training paramedics to start patients on it after reviving them, they could get almost 6 times as many people into drug treatment within the following month. But these conversations can be difficult for first responders, so they follow a mental script.
Here's the way we kind of script it and how we think about it, right? So a patient overdoses, they stop breathing. Everyone runs around. Finally, 911 shows up. Maybe some Narcan has been given, hopefully, because that's getting better. Maybe it hasn't. We ventilate the patient with a bag valve mask, and the patient breathes, and then they start to wake up.
You all right?
Yeah.
And that used to be where we finished, and this is where it's game on.
Ralph. Hey, buddy. You all right?
They're going to be disoriented. They're definitely not going to feel good. And pretty quickly as they wake up, they're going to wonder where they are, realize where they are, and then wonder what's happened to them why they were not aware.
Have a seat, bud. There you go, we got you, Ralph. We got you. There you go.
You'd be interested in taking the subs right now?
Yeah.
Get you feeling better?
And I think that conversation, that piece, the idea that our paramedics tag off if one's not connecting, and then administering the medicine, and all of that happens in less than 10 minutes.
Right now, 2 tabs under your tongue, all right? We're going to hang out with you, make sure you feel better. If you need more, we'll give you more.
Here, open up. Lift your tongue up. They go right underneath your tongue.
And I think that kind of scripting really makes this program work. And I think when paramedics and EMTs think about that, I think they can see how they could do it too. It's not a solution to the opioid crisis, so I don't want to overstate anything. But when patients take it, and I would say I think our uptake is somewhere around 1 in 10, 1 in 12. But of those, about 30 to 40% make their first and second appointments and are in treatment at about 30 days.
That comprehensive treatment is led by Dr. Caitlin Baston, the head of Cooper University's Center for Healing.
What do you do the first time you meet with them in the clinic?
We basically ask what their needs are that day. Food, clothes, shelter, community and engagement and love, which is a basic need, and medication. If you don't have your basic needs met, it's really hard to engage well in therapy or work on your trauma.
Services to help with mental health, housing, employment, and other basic needs are also offered here. An all-encompassing, revamped approach to treating addiction.
We saw paramedics and EMTs and frontline workers, police officers, nurses, folks in the hospital, overdose reversing people, giving them emergency naloxone over and over and over again. And they felt like the patients were failing. But we never gave those patients treatment. We just reversed them. It'd be like if someone had a heart attack and we immediately stabilized them, but then gave them no medicines to prevent the next heart attack. And they were like, weird, they had a heart attack again.
In 2019, the New Jersey Department of Health approved a $250,000 grant to fund paramedics to carry and offer BUP on emergency calls.
What kind of pushback did each of you get?
It's very easy to give Narcan and wake someone up. It's another thing to actually talk to someone and try and reach them where they are. That's a different skill set.
They were like, this is not going to work, this is hopeless. And what I think really turned the tide for a lot of them is we had them spend some time in the addiction clinic. You start to see them really as the person that they are. It's complicated how they got to where they are.
It's that understanding that it's a complicated problem, and there's a lot more that paramedics can be doing in the field. It's making a difference. One emergency call at a time.
What are you seeing with overdose rates?
In Camden County, we actually saw overdose rates stay stable or go down a little bit, while overdose rates were still skyrocketing in every other county in New Jersey.
But it's not a quick fix.
People think if you just get through the withdrawal, you've now treated the illness. But we know there are brain changes that are chronic that happened, and it's not just getting through withdrawal that treats it. You have to actually be on a stabilizing medicine and then have long-term recovery for your brain to heal. And the brain can heal, but you need time.
What would you say to people who would say, these are just more drugs that you're giving people, it's another addiction?
It's a difference between addiction and a medication or a treatment, right? Addiction is an out-of-control use. And when my patients say, aren't I just trading one drug for another? I'm like, yes, you're trading one very dangerous illegal drug that you can overdose on that causes all these terrible things to happen to your brain for a safe prescribed medicine that you can get from the doctor at a pharmacy, and you're gonna live a normal life. I would make that trade any day.
This is like game changing.
Yeah.
It seems like. And I said to you in the middle of the piece, if you think about that 30 to 40% that they mentioned that actually, after that first treatment, get to that second moment of potentially treating this addiction that they've had, that seems huge.
That's pretty good, right? 30 to 40% of people who we might have failed that we're actually starting to get into treatment. And, as they say in the piece, it's not enough to reverse somebody's overdose. That's just step one.
Right.
It's like making that diagnosis of a heart attack. It's not enough to do that. You really need to get somebody into treatment.
Does that emergency treatment also work with other drugs like heroin, fentanyl, in overdose situations?
So the Narcan naloxone, that's the step one piece. Yes, so any of those drugs that'll help reverse and wake you up, but then you do need to continue with some other treatment, and what they're using here in the field is buprenorphine.
Huge step.
Huge.
Yeah.
Thanks, doctor.
Thank you.